Namaste. Today I am going to discuss the topic Parkinson's disease. Parkinson's disease is a movement disorder of the nervous system that gets worse over time. As neurons in parts of brain weaken or damaged or die, people may begin to notice problem with the movements, tremor, stiffness in the limbs or the trunk of the body, or impaired balance may occur. As symptoms progress, people may have difficulty to walking, talking, or completing other simple tasks. Not everyone with the symptoms are more used to Parkinsonism, as the symptoms appear in other disease as well. So, Parkinson's disease is a progressive disorder that affects the nervous system and the part of the body controlled by the nerves. So, symptoms start slowly. The first symptom may be a barely noticeable tremors in just one hand. Tremors are the common, but the disorder may also causes stiffness or slowing the movement, etc. In Parkinson's disease, certain nerve cells called neurons in the brain gradually break down or die. So many of the symptoms of Parkinson's are due to loss of neurons that produces the chemical messenger called dopamine. So when dopamine level decreases, it causes irregular brain activity, leading to problems with the movements and other symptoms. So Parkinson's disease, the causes of this condition is unknown, but several factors appear to play a role, including genetical factor or genes. So researchers have identified specific genetic changes that can cause Parkinson's disease. So these are uncommon except in rare cases with many family members affected by Parkinson's disease. So, certain gene variations appear to increase the risk of Parkinson's disease. Second comes environmental triggers. So, exposure to certain toxins or environmental factors may increase the risk of later forming Parkinson's diseases. Next comes symptoms of Parkinson's disease. So, early symptoms may be mild and go unnoticed. So, symptoms often begins on one side of the body and usually remaining worse on the other side, even after the symptoms begin to affect the limbs on both the sides. Parkinson's symptoms may include tremors. What is tremor? Rhythmic shaking called tremor usually begins in a limb, often hand or fingers. You may rub your finger back and forth. This is known as pill rolling tremor. So hand may tremble when it is at the rest position also. The shaking may decreases when you are performing some tasks. So slowed down movement is the second symptom. It is called bradykinesia. So in Parkinson's disease may slow your movements, making simple tasks difficult to or the time consuming process. The step may become shorter when you walk. So this is difficult to get out of the chair. So next comes rigidity of muscles. So muscle stiffness may be occur in any part of the body. The stiffness of the muscle can be painful and limit your range of movements. Impaired posture and balance also one of the symptoms of Parkinson's disease. Next comes loss of automatic movements. For example, you may have a decreased ability to perform unconscious movements, including blinking, smiling, swinging your arms when you walk. Speed changes. You may speak very softly or quickly, slur or hesitate before talking. Your speech may be more of a rather than have an usual speech pattern. Writing changes, it becomes hard to write and your writing may appear small. In Parkinson's disease, it also accompanied by some other additional problems. First comes thinking difficulties. In Parkinson's patient, they experiences problems such as dementia and thinking difficulties. So these usually occur in the later stages of the condition. Second comes depression and emotional changes. So in Parkinson's patient, they are experiencing some kind of depression or sometimes in the very early stages also. And other emotional changes such as anxiety, fear, or loss of motivation, etc. Next comes swallowing problems. So, the Parkinson's patient develops difficulties with the swallowing as the condition progresses. So, because saliva may accumulate in the mouth of the patient and slow the swallowing, leading to drooling, etc. Next comes chewing and eating problems. In this condition, the muscles of mouth may affect, so difficulty to chewing may occur and causing choking and poor nutrition, etc. Sleep problems also one of the main complications of Parkinson's diseases. In patients, sleep problems including waking up frequently throughout the night, waking up early, or falling asleep during the daytime, etc. Bladder problems also we can see in the Parkinson's patients, including being unable to control the urination or having difficulty in urinating, etc. Next comes constipation issues. Many people with Parkinson's disease develop constipation mainly because of the slower digestive tract.